The Venezuelan capital, home to nearly 3 million people and until recently relatively free of the coronavirus. But no more. On Sunday, President Maduro described Caracas as riddled with the infection. Over 60% of new cases, he said, were in the city. The spread appears to have struck his own inner circle. Two of Maduro's most senior advisors, including the country's oil minister, were notable absentees from the broadcast, both apparently recuperating from the virus. There's also been an outbreak inside the headquarters of state television, VTV, with 45 employees, including the station's president, testing positive. The Maduro government's approach to controlling the infection has been unconventional. A rotating system of 7 days of quarantine, followed by 7 days of relative normality. Adherence has been patchy. During the supposed radical phase of quarantine, we found plenty of people out and about. You have to go out. How else do you provide for your children? Asked this woman, who was selling homemade face masks. The city is full of rumours of the latest outbreaks. This woman said she'd heard there were cases nearby, but she didn't know if it was true. Doctors say that with the country carrying out few tests, it's hard to know what the real numbers are. And there's concern that after years of recession, many hospitals are ill-prepared to cope with an epidemic, given they are short of staff, equipment, and in some cases even running water.
As far as the epidemics it's rising, we are getting in more trouble, and we are getting to the even break point line of capacity to attend people in the ICUs or in the emergency room.
The Maduro government blames US sanctions for the lack of medical supplies. In recent weeks, it has received aid from international donors. But still, there are growing fears that Venezuela, late to be infected by this virus, may end up being hit hard. Stephen Gibbs for CGTN.